So magically 1970 is in your conversation piece. And what happened during that time frame to change that trajectory?
I was thinking the same thing.
Well, on the money side, a very bad thing happened when Richard Nixon was president, which is essentially the United States dollar was completely unleashed from gold. So after 1971, just not even by Congress's decree, but by the decree of Richard Nixon, foreign governments could no longer exchange their dollars for gold. So some people view 1971 as very, very important in terms of the devaluation of the U.S. dollar and things getting more expensive for average people. So that's one thing. But also, really in the 1970s and then increasingly in the 1980s, we started to develop this idea of health insurance.
Right.
And this is where a third party got involved in the equation between a doctor and the doctor's patient, or between a pharmaceutical company and someone who is using the drug. And at first, this took the form of government programs like Medicare and Medicaid, which, Medicare was passed in the 1960s and really got rolling in the 1970s. But then it started to take the form of ostensibly private third-party health insurance companies, HMOs, PPOs, and the like. And so both of these factors drove a wedge between doctors and patients. And we think a lot about the Hippocratic Oath and the idea that doctors owe a really important ethical duty of care to their patients, not to the dollars that they're charging, or not to a third party who might be paying them in the form of government or a health insurer. And once you get third parties involved in that equation between a doctor and a patient, very quickly we saw costs get out of whack. Because it's very, very simple. It's human nature. When we think something's free, or when we think something has a fixed cost, I have to pay my monthly or annual premium, or I have to reach my monthly or annual deductible. But beyond that, it's free. Human nature tells us that people are likely to consume a lot more of that free medicine than they might need. So it really started an upward spiral in prices and a downward spiral in the quality of care, because rather than just simply being focused on the patient and the patient's needs, doctors and doctors' offices, their staff, started to get a lot more involved in billing, started to get a lot more involved in administration. And these things added a lot of overhead. And of course, off to the side, not unrelated, but off to the side, you had malpractice and malpractice insurance starting to go up and up and up during that period. So things really changed. And certainly my parents' generation and my grandparents' generation, they went to the doctor and they paid cash. Right. They paid cash for virtually all basic services, including, a week in the hospital for, let's say, delivering a baby and having a baby. Can you imagine staying in the hospital now for a week with just a normal, easy childbirth? I guess there is no easy childbirth, but one without complications. So it's a very different world now that we're in a third-party system rather than a direct paying system.
Well, and when you look at that example of having a baby in the hospital, staying there in a week, now regular delivery is, I've heard, as you know, in without a free market, the prices are all over the place. But I've heard, there's hospitals that charge $40,000 to have a regular vaginal delivery birth. And back in the 70s, I remember my uncle who had my cousin and paid cash. It was like $500.
Mm-hmm. Mm-hmm.
So the prices have just skyrocketed, mostly because there's a third party involved. And so the actual direct consumer doesn't have to keep that price in check.
Well, interestingly, Dr. Ron Paul was an OBGYN. He's delivered about 4,000 babies, it is estimated. And when he got out of the Air Force and started his own practice in a small town in South Texas, which was near the Air Force base, where he had ultimately been stationed after the Korean conflict, he had a waiting room full of patients from an older retiring doctor. He made some arrangements with that older retiring doctor to purchase, the physical equipment in the office and later the building. He had no debt from medical school. He'd been able to work his way through and take up shifts at the ER to pay for that. Every member of his staff, when he started his practice, was involved in direct patient care because there wasn't any billing. Mm-hmm. It was cash only. And everything from the first visit through to the hospitalization delivery was just a few $100s, as you mentioned. And more importantly, this is the late 1960s. As an OB, mind you, he had no malpractice insurance. It just conceptually didn't exist yet. So that shows you how different the landscape is. And of course, Keith Smith will talk about this, like all doctors, like all medical doctors across all specialties and practices. In the late 1960s, Dr. Paul knew there were certain women in his area. This was a geographic thing. There weren't very many OBs in South Texas. Some women simply wouldn't be able to pay. And he would either treat these women for free or he would give them a discount, or sometimes they would even give other, types of payment back then. But this was just understood and accepted by doctors. It wasn't considered some big noble sacrifice. It was just part and parcel of being a doctor. Some women were poor and unable to pay him, and that was, a certain 10% or whatever would just be part, baked into his the economics of his business. And my gosh, doesn't that sound pretty good now?
Yeah. So how do we get back there? Have we gone too far?
I think we've gone too far. Look, we know the model. That's the thing is we don't have to create the correct business model. We've already got that. All we have to do is look at a time when American medicine was the envy not only of the world, but even of the developed and industrialized world. And that model is very simple. Plus, it would benefit from all the wonderful technologies and medicines we have today, which we didn't have 30 or 50 or 75 years ago. But the model is very simple. You pay cash for basic services. That means when you go to the dentist or the eye doctor or the urgent care for those sniffles or go check out your tennis elbow, all of that basic services, you pay cash. And if you're Barbara Streisand, you probably have a very fancy concierge doctor and you pay them $10,000 a month and they come to your house and treat you like royalty because you're a rich person. And if you're a person of very modest means, perhaps working several lower paid jobs, you go to a Walmart clinic and they charge you $40 or $50 for the visit, okay? And everything in between. But none like cash for basic services. Now, when it comes to serious illness, hospitalizations, accidents, the kind of things that we can apply risk measures against and that we can insure against because we can get statistics about how likely they are to happen. The market would allow for high deductible catastrophic policies. So you could go buy a policy. You might have a $10,000 deductible, but it would be very, very inexpensive against something like cancer or heart attack or stroke or serious illness. And the premium on that high deductible policy would be very low and very cheap if you were young and healthy. Now, as you get older and less healthy, or if you have some bad habits in your life, that's just how things go. There would be some actuarial risk assigned to that, and you would be assessed a premium based on your risk profile. But in your 20s, just out of school, let's say, it would be very, very inexpensive. And then finally, we would have charitable hospitals, charity, doctors like the aforementioned Dr. Paul treating the truly poor and the truly indigent in society. So those would be the three stools of the model. So, that's the economic model. The question is, how do we ever get back to that when we've muddied the water so unbelievably with Medicare, with HMOs, with PPOs, with Obamacare, which actually requires you on paying a penalty. Now, the Trump administration got rid of that penalty, but nonetheless, under paying a penalty to have health insurance. That's not a market, folks. When the government tells you have to have something and you go buy it, that's not the free market. That's cronyism or maybe even fascism under a particular definition. But so we're a long way from that three-pronged model that I laid out.